So today we're going to be talking about CAT MUDPILES. If you're wondering what CAT MUDPILES is, it is the differential diagnosis that we are looking for when we have an anion gap metabolic acidosis. As you know, the anions can account for the acid-base balance, but if we have a gap between those anions and we know something is in your blood that is accounting for that anion gap that's not your typical electrolytes, sodium, the potassium, the chloride. So some of the things that can be in there are CAT MUDPILES. And we're just going to go over how a patient who could come to me with an anion gap metabolic acidosis and have some neuro-ophthalmic complaint. So we're going to start with carbon monoxide here. Carbon monoxide is a poison, as you know. Most commonly it occurs when patients are using space heaters in their home and they're not properly ventilating. People also try to kill themselves by locking themselves in the garage and letting the exhaust fumes overtake them. And so this presents to me as a noxic encephalopathy and cortical vision loss. Aminoglycosides can cause neurotoxicity, ototoxicity, vestibular toxicity. And so this person with the aminoglycoside toxicity comes to me with a disruption of the vestibular ocular reflex. So they have dizziness and imbalance, oscillopsia from nystagmus because they can't suppress their vestibular ocular system to match the movement of your head. Toluene is for sniffing paint. So those are like homeless kids who are huffing. They take a paper bag and they huff the paint. Or glue sniffing. This also comes to me with demyelination in the cortex and can come to me as a cortically blind kid. Methanol, that comes to me as a bilateral simultaneous loss of vision acutely. Usually it's from moonshine. So they've either consumed somebody's wood alcohol or they're trying to kill themselves because methanol is in a lot of different home products like windshield washer fluid. So it presents to us as acute bilateral loss of vision. We want to dialyze this out, and also we're going to do fomepizole, which is the competitive antagonist of the alcohol dehydrogenase. Uremia, that causes uremic optic neuropathy. It's one of the causes of patients who have kidney failure to be blended. They also need dialysis. And diabetic ketoacidosis. This comes to me as a patient who has an infection. So usually they have the orbital apex syndrome because they have sinus disease. That sinus disease is mucormycosis in a patient who has diabetic ketoacidosis. You have to control the acidosis before you go after the mucor. Propylene glycol, that really doesn't come to me. INH and ethambutol are in patients who are being treated for tuberculosis, and they come with a bilateral, slowly progressive central scotoma from a retrobulbar optic neuropathy. So if we stop the ethambutol, but they're still losing their vision, we would be thinking about INH toxicity, and we would stop that drug too. Lactate, that comes to me from mitochondrial disorders, where there's a problem with the mitochondrial production of ATP, and the most common things that we see with this in are lactic acidosis and stroke-like episodes. So that's MELAS, so they have a mitochondrial-based encephalopathy with lactic acidosis and stroke-like episodes. That can come to me a stroke in the brain or a stroke in the eye. So they're going to have a lactic acidosis. Ethylene glycol looks similar to methanol. It's usually a toxicity from either an intentional or unintentional exposure to ethylene glycol. This is an antifreeze. So people either try and kill themselves, or it's a kid that's been poisoned, or somebody's trying to poison you. And salicylate doesn't really come to me. This is aspirin. So if you have a patient who has a neuro finding and has an anion gap metabolic acidosis, think about CAT MUDPILES.